So Good Luck and I are here at Kilwa dispensary. This is one of the dispensaries that we're visiting to do data supervision with the health staff here. One of the problems that's facing the health system in Tanzania, but very specifically to Kilwa, is that there's a really big lack of human resources. So in Kilwa, for example, they're about 66% understaffed, meaning they have about 33% of the staff that they have projected that they need for the entire district. So one of the issues is that it's really hard to recruit staff to work in the rural areas, and most of Tanzania actually is rural areas. So if you can see in the distance, there's not many houses because the housing the population isn't very dense. So as you can see, here's the actual dispensary here, but then if you look over to the side here, there's some housing that's actually built, and this is a typical way that they build the dispensaries, is that they'll build dispensaries and housing in the same area. And so it works here at Kilwa, but a lot of times what they'll do is they'll only have built the dispensary and they won't build housing for the nursing staff. So when they recruit them to come in and there's no housing for them to stay at all, it makes it a larger barrier to even have them recruit in the first place. So we figured that there's two different ways that you can actually help this problem. One of the ways is recruiting more staff, and that's something that they continue to try to do, but Good Luck and I have sort of worked under the conditions that we don't think that they are going to be able to recruit that many more staff in a short period of time. So the other way to make improvements is actually make the staff that are here more efficient and more effective with their time. So we've been doing that by trying to allow them to gather better data so that they get more information on the health of their communities, so that they can make more informed decisions about how they actually plan and implement the health programs that they have here. So thereby doing it, it helps them be more effective with the work and the time that they have during their day. And we're also making the process of actually filling the data out an easier process, a more streamlined process that takes less time. So it's more efficient and more effective for them.